Your Excellency, Felix Antoine Tshisekedi Chilombo, the President of the Democratic Republic of Congo and Chairperson of the African Union for the year 2021. Your Excellency, President Paul Kagame of the Republic of Rwanda and African Union's champion for domestic health financing. Your Excellency, Cyril Matamela Ramaphosa, the President of the Republic of South Africa and African Union's COVID-19 champion. Your Excellency, Musa Faki Mahamat, the Chairperson of the African Union Commission. Your Excellency, Ellen Johnson Sirleaf, the former President of the Republic of Liberia. Your Excellency, Festus Mogae, the former President of the Republic of Botswana. Director of the Africa Centers for Disease Control and Prevention, Dr. John Nkengasong. Ms. Rita Roy, the President and Chief Executive Officer of the Mastercard Foundation. We are also joined online by Dr. Tedros Adhanom Ghebreyesus, and he is the Director General of the World Health Organization. Online as well is Dr. Ngozi Okonjo-Iweala, who is the Director General of the World Trade Organization. We also have Dr. Vera Songwe, who is the United Nations Under Secretary General and Executive Secretary of the United Nations Economic Commission for Africa. I would also like to take time to acknowledge the presence of the many respected high-level personalities joining us today, including special envoys of the African Union who are playing critical roles in saving lives and saving livelihoods in Africa. Fellow Africans, distinguished guests, welcome and thank you for honoring the African Union, the Africa CDC, and the Mastercard Foundation. The purpose of our event today is to announce a bold new partnership between the African Union, the Africa CDC, and the Mastercard Foundation, titled Saving Lives, Saving Livelihoods. This is a very timely partnership that aims to expand Africa's access to COVID-19 vaccines, to improve public health, and also to enable economic growth. In a few moments, Ms. Rita Roy of the Mastercard Foundation and Dr. John Nkengasong of the Africa CDC will share more on the specific details of that partnership. But before we come to them, let me hand over to the Chairperson of the African Union Commission, His Excellency Musa Faki Mahamat, to officially welcome us and also to share his opening remarks. Your Excellency Chairperson, you have the floor.
Thank you very much. Excellence Felix Tshisekedi.
Excellency Felix Tshisekedi, the President of the DRC and the Chairperson of the AU, His Excellency Cyril Matamela Ramaphosa, President of the Republic of South Africa, AU COVID-19 champion, His Excellency Paul Kagame, President of the Republic of Rwanda and AU domestic health financing champion, Rita Roy, the President and CEO Mastercard Foundation. It is with a great pleasure on behalf of the African Union to wish you a great welcome to the launching of the foundation, with the Foundation of Mastercard, on the theme Saving Lives, Saving Economies, and Saving Schools, a partnership to vaccinate Africa. In the pandemic, in the fight against the pandemic, this pandemic continues to ravage the world, but as well as our societies. We will continue to work tirelessly for more than 1 year to bring responses to this sanitary crisis that not only devastates lives of millions of people, but living conditions as well as means of survival. A new Today, a new page has opened up in our continent, and indeed, the objective of the African Union, as announced in the Strategy of Africa of Development and Access Strategy, and to vaccinate at least 60% of its population, about 750 million people, or its entire adult population, by the end of 2022. Today, more than 2% of the Africans have received one dose of the vaccine, which is in fact wearing and very far from the objective. So the Mastercard partnership comes at the right moment in order to that will enable the purchasing of 50% and will provide the basis of the vaccinations production on the setting up of the human resources and strengthening the capacities of Africa CDC. Excellencies, ladies and gentlemen, I wish to avail myself of this opportunity and in particularly to express our gratitude to the foundation, Mastercard Foundation, for this partnership without precedents with the African Union. We'd like to thank Madame Rita Roy and her team who have joined hands and made this possible. We like to assure her that Africa CDC, that they will not be disappointed, and the Africa CDC will be available to work together for the benefit of the entire African continent. I wish to thank the Social Affairs Department, Amina Edfadel, and the Africa CDC, and at his helm, at its helm, Dr. John Nekasong. And to make this a reality, I'd like to thank the heads of state and of government who have been here since the beginning of the pandemic, have left no stone unturned for the fight against the COVID-19. And personally wish to thank President Kagame, President Ramaphosa, and President Tshisekedi. Excellencies, ladies and gentlemen, I wish to assure you of the firm commitment of the African Union Commission to maintain the synergies to support these partnerships in order to protect the health of our continent. And so through these strategies, Africa that what we want is a great ambition because we shall work together hand in hand, and together it will be an ambition that will be of reality as we are ensuring that this partnership historic between Mastercard and Africa. I thank you for your attention.
Thank you very much, Excellency Chairperson. That was the Chairperson of the African Union Commission, His Excellency Musa Faki Mahamat. Just really going over some of the main critical points there. For example, he spoke about the target of vaccination being 60% of the African continent, and that amounts to about 750 million people. He also extended the gratitude of the African Union Commission for the leadership, the great leadership that has been shown by African heads of state and government as we fight this pandemic. So thank you very much, Excellency Chairperson. Without much further ado, let me now welcome Ms. Rita Roy to shed more light on the new partnership that we are here to launch. Rita Roy has been the President and the Chief Executive Officer of the Mastercard Foundation since 2008, during which time she has helped to focus the foundation's considerable resources on Africa, and particularly on African-led initiatives. Rita herself recently relocated to the continent as part of an effort to make the foundation better aligned and more responsive to the needs of the continent. Ms. Rita, I will presume to speak on behalf of all of us in saying that we are very glad to have you here with us and are very encouraged by the work of the foundation. So, ladies and gentlemen, please join me in welcoming Ms. Rita Roy of the Mastercard Foundation. Rita, you have the floor.
Thank you very much. Your Excellency, President Felix Tshisekedi, Your Excellency, President Paul Kagame, Your Excellency, President Cyril Ramaphosa, Your Excellency, Chairperson of the African Union Commission, Moussa Faki Mahamat, Director of the Africa CDC, Dr. John Kengasong, the Board of Directors of the Mastercard Foundation, distinguished guests, welcome. Thank you for joining us. Let me begin by thanking the leaders represented here today who have safeguarded the health of their people and of Africa's future. Some of you are meeting us for the first time, so please allow me to introduce the Mastercard Foundation. We are a Canadian foundation created in 2006 through the generosity of Mastercard Inc. when it became a publicly listed company. From inception, the Mastercard Foundation was established as a separate and independent organization with its own governance structure. Our foundation's policies and decisions are made by our board of directors. And early on, our board made a pivotal decision that the foundation would focus its work in Africa. So for more than a decade, we have worked with many partners in 30 African countries to expand access to financial services and education to improve the lives of millions of people. A few years ago, we began implementing Young Africa Works, a strategy that addresses something on the minds of every parent, every leader, and every young person: jobs, employment for young people. We set a goal to enable 30 million young people to access dignified and fulfilling work by the end of this decade. The majority will be young women. To undertake this strategy, we transformed ourselves. We opened up offices in 7 countries across the continent, hired wonderful staff, based our leaders, including myself, in Africa. And importantly, we committed that 75% of our partners will be African organizations. We remain committed to implementing Young Africa Works, but it's difficult, it's challenging to forge ahead until we fully address COVID-19. We applaud the response of African leaders through the African Union, the Africa CDC, and in the private sector. Their work was exemplary. They took swift, coordinated, science-based actions to stem the virus. Last year, the African Union set a goal to vaccinate at least 60% of the population by 2022. And through the efforts of the African Vaccine Acquisition Task Team and COVAX, the continent expects to have vaccines for between 45 to 50% of the population. So a gap still remains to be closed. We began this year with hope that vaccines would be deployed fast to turn the tide of the pandemic, to make sure everyone was safe, and that we could begin the work of rebuilding and recovery. Still, inequities persist. As you've heard, less than 2% of Africa's population has been vaccinated, in contrast to over 50% in other regions. Addressing this inequity is a moral imperative. It demands a response from governments, from the private sector, from international partners, from all of us. So today, I'm really honored, I'm humbled, and I'm grateful to announce a bold partnership. The Mastercard Foundation will deploy $1.3 billion over the next 3 years in partnership with the Africa CDC to save lives and livelihoods of millions of people and to hasten the economic recovery of the continent. This partnership has 4 key priorities. First, to acquire vaccines for at least 50 million people. Second, to support the delivery and rollout of vaccinations to millions more across Africa. Third, to prepare the workforce for vaccine manufacturing in Africa. Fourth, to strengthen the Africa CDC and enable it to undertake this historic initiative in partnership with countries. This initiative is inclusive of all member states of the African Union. It builds upon the enormous progress of African leaders and their national vaccination programs. It also builds upon the work of COVAX, the World Health Organization, the European Union, the US, and other international partners. We expect that this initiative is also an opportunity to unlock the economic potential of the health sector and create jobs and work opportunities for thousands of people so they too can begin the recovery. The key word here is partnership. All of us have a stake in ending this crisis. We can and we must make the systemic investments to increase global health security and economic resilience. We all have a sense of urgency, but let's also be optimistic. Even now, there are many reasons to be optimistic. From the innovation we've seen across Africa in response to the pandemic, to the unprecedented collaboration, exceptional leadership, and feats of science here in Africa and around the world. Hopefully, best of us is still to come. Thank you. Now let me hand over to Dr. John and Kangasong to elaborate on this partnership. Over to you, John.
Thank you, Rita, for this extraordinary moment. What is going to be recorded as a game changer in our ability to fight COVID-19 on the continent. Excellencies, Head of States, President Tshisekedi, the Chair of the African Union and President of the Democratic Republic of Congo, His Excellency President Kagame, President of Republic of Rwanda, and our champion for herd financing, His Excellency President Ramaphosa, President of South Africa, and our champion for COVID-19, His Excellency Musa Faki Mohammed, our Chair of the African Union Commission, Rita Roy, the CEO and President of the Mastercard Foundation. It gives me a great pleasure to walk you through in a very short presentation in details what this partnership is all about. As Rita said, this is about saving lives and livelihoods, and it's underpinned by the power of partnerships for COVID-19 vaccination in Africa. Mastercard has always met us at a point of needs. In 2020, when we launched the Partnership for COVID-19 Testing, in abbreviation PAT, launched by His Excellency Musa Faki Mohammed, the Mastercard Foundation was there to support us with $40 million. And now in 2021, with a Partnership for COVID-19 Vaccination in Africa, saving lives and livelihoods, they have answered present. As Rita has mentioned, the continent is lagging behind. It's actually at the curve of vaccination. This world map shows you where we are, and the darker the red color, the less vaccination have occurred. As you can see, the continent as a whole has conducted or has immunized less than 2% of its population of 1.3 billion people. And this is some statistics for you to take home. The world, as we speak today, has administered about 2.2 billion doses of vaccines. Of that, the continent has acquired 54 million doses of vaccines, and 32 million of the vaccines have actually been administered in Africa. This is what Rita had indicated. We are a continent of 1.3 billion people, and our estimated coverage is at least 60%. That means we must immunize about 750 million people. I'd like to walk you through the slide on the right-hand side slowly. The vertical axis represents our percentage vaccination coverage. COVAX facility, which is an initiative supported by the World Health Organization, the Global Vaccine Alliance, and CEPI, that is the Coalition for Epidemic Preparedness Innovation. is going to supply us with at least 26% of our vaccines. That is about the ability to vaccinate up to about 340 million people. The AVAC process, which is the African Vaccine Acquisition Task Team, has acquired up to about 400 million vaccines. That is the ability to vaccinate up to 31% of our population. So if you sum over that, all of that, we still have a gap of about 3%. Now, I really want to point out that the 31% of AVAC acquisition is actually supported by partnerships like the Afri-Exim Bank facilities and additional partners. That is where we are calling for additional partnerships to support us to get to these percentage targets. Now, this initiative is actually geared towards that. And as Rita has indicated, we have 4 objectives: to acquire more vaccines to enable us reach our 60% target, deploy the vaccines effectively, strengthen continental manufacturing capacity, and strengthen Africa CDC's ability to provide and coordinate this support on the continent. There are several benefits that will occur from this partnership. One is the ability to win the battle against this pandemic. Second is to roll out vaccination capacity across the continent, regardless of which vaccines are being supplied. And thirdly, to strengthen African institutions that will drive an impact in public health. And lastly, to ensure our national, regional, and global health security. We have established some guiding principles in this strategic partnership. One is inclusiveness. All member states are eligible. Second is equity, driven by member states' needs. Accountability, we want to ensure that the resources are efficiently and transparently used, and that the partnership is African-led and driven. Collaboration is key. We will strive to collaborate with all parties and partners, of course, including the World Health Organization, member states, UNICEF, and others. Improvement of national health systems is central as a principle. Iteration and learning processes. That is, we are going to be learning as we go. There are 8 key areas that this partnership will focus on. One is vaccine acquisition and logistics, strengthening countries' logistics, supporting vaccination centers and staffing, community engagement and risk communication. We shall be also strengthening the continent's ability for pharmacosurveillance, genomic surveillance of the viruses that are emerging, strengthening digital tools to track how the vaccination programs are going and provide technical assistance across the continent. Let me just end by thanking a group of people that have been working relentlessly. And I must say that it has amazed me that over the last 1.5 years, this group has been meeting almost nightly, on nightly basis from 9 p.m. to 11 to discuss vaccine and vaccination work across the continent. I include Mr. Strive Masiwa, who is the AU Special Envoy, and we call him, when we meet every evening, a COVID vaccine warrior. Dr. Vera Songwe, who really wanted to be present today but is traveling, has been exceptional. Professor Benedict Orama, the president of the Afri-Exim Bank, and the team have been extraordinary in coordinating these efforts with us. Special Envoy Donna Kaburuka and Commissioner Amira have all been critical in guiding us. I've personally benefited a lot from their counsel as we've thought through this initiative, how to get vaccines and get our continent vaccinated. I thank you so much for the opportunity to partner with Mastercard. And Rita, with special thank you to you for your relentless Africa CDC and African Union Commission in the fight against the COVID-19 pandemic. I thank you.
Well, thank you very, very much. That was Dr. John Nkenga Song, the director of the Africa CDC. We first heard from Ms. Rita Roy, who has announced the value of the partnership that we are launching today. And she has stated that it is worth $1.3 billion. Both Dr. John and Ms. Rita have gone over some of the objectives of this partnership, which aside from ensuring that we have vaccines, also talks about strengthening the manufacturing capacity on the continent and to prepare the workforce, as well as to strengthen the Africa CDC. So it is clear from the speakers that have gone on before that there is a gap in our vaccination and we need to boost it. Hence, this very important partnership. So thank you very much. It is now time for us to start bringing in our excellencies, the heads of state and government who are joining us today. And first, let me call upon His Excellency Felix Antoine Tshisekedi, who is the President of the Democratic Republic of Congo, but is also the Chairperson of the African Union for the year 2021. Excellency President, you have the floor. All right, I think perhaps His Excellency is still trying to connect, so let us move on. It is now my honor and pleasure to welcome Rwanda's President, President Paul Kagame, who is on standby with his delivery. Excellency, you have the floor.
Thank you very much, Moderator. Excellency, President Felix Tshisekedi, Chairperson of the African Union, Excellency Cyril Ramaphosa, President of the Republic of South Africa, Excellency Moussa Faki, Chairperson of the African Union Commission, Excellencies, former heads of state, heads of partner institutions, Ms. Rita Roy, President and CEO
Madam Rita Roy
of the Mastercard Foundation and the Board of Directors, Dr. John Nkenga Song, Director of Africa CDC, distinguished ladies and gentlemen. First of all, I want to say congratulations to everyone involved in this historic partnership to strengthen Africa's public health institutions. I thank the Mastercard Foundation for this commitment, especially the CEO, Rita Roy, and the entire board of directors. I also commend Chairperson Moussa Faki and the African Union Commission, in particular, the African CDC led by Nkenga Song. We do not take for granted how much hard work is involved to turn such an ambitious idea into reality. In 2009, the Mastercard Foundation made a decision to focus on Africa. That promise continues to be delivered upon in ways that are making a real difference on our continent, notably in the areas of education and youth empowerment. I want to draw attention to three critical features of the partnership we are launching today. First, it is practical and immediate. Lives are going to be saved through the vaccine purchases. Second, there is a commitment to work directly with our public health institutions and make them stronger. Creating parallel systems has not been effective or sustainable. Third, there is a long-term vision to build Africa's capacity to produce high-quality medicines and vaccines right here on our continent. As Africa, we have to do our part with a sense of urgency and excellence. We won't get out of this crisis with a business as usual mindset. That means investing much more of our own domestic resources in our national health systems. The African Union Commission and the African Union Development Agency, NEPAD, have technical resources to assist member states with this priority. I want to close with a word of recognition and appreciation to the many other bilateral and multilateral partners who contribute to health in Africa. This new partnership between the Mastercard Foundation and Africa CDC builds on those investments and will help all of us accomplish even more together in the future. Once again, congratulations, and I thank you for your kind attention.
Thank you very, very much. That was His Excellency President Paul Kagame of the Republic of Rwanda. And as we said at the beginning, His Excellency is also the African Union's champion for domestic health financing. Now, the President spoke very passionately about this partnership, mentioning, of course, that and highlighting its commitment to work with public health institutions on the continent. He also commended the long-term vision that accompanies this partnership, but also really spoke strongly about the need for Africa to invest in our own health systems. So we thank you very, very much, Excellency, for that very powerful delivery. We now move on, and it is time for me to call upon the Minister of Health for South Africa, Dr. Zweli Mkhize. And Dr. Zweli is standing in for the President of the Republic, President Cyril Ramaphosa, who is also the African Union's COVID-19 champion. Dr. Zweli, we welcome you to this meeting, and please, you have the floor.
Thank you very much, moderator of the session, the chairperson of the AU Commission, His Excellency Mr. Musa Fakir, Excellencies, the chair of the African Union, His Excellency President Felix Tshisekedi, His Excellency President Paul Kagame, the Director for Africa CDC, John Kengasong, the CEO of the Mastercard Foundation, Ms. Rita Roy, Executive Secretary of the UN Economic Commission for Africa, Dr. Vera Songwe, and the AU Commissioners and Special Envoys, guests, ladies and gentlemen, I stand here to deliver a message of support from President of South Africa and the special champion for the COVID-19, His Excellency President Cyril Ramaphosa. Allow me to begin by thanking the Mastercard Foundation for its generous support for the cause of equitable access to COVID-19 vaccines. This is welcome intervention that will scale up efforts to finance vaccine procurement, delivery, and uptake on the African continent, as well as support local manufacturing. It's also a vital shot in the arm to the African Centers for Disease Control and Prevention, and will significantly strengthen our continental response. Africa has and needs a strong CDC. For this to happen, it needs to be well-staffed, including through appointment of public health fellows, needs adequate space, and it needs to have excellent means of communication. The support from the Mastercard Foundation will go a long way towards strengthening the Africa CDC capacity to conduct research, give guidance to countries, and deliver much-needed services. The COVID-19 continues to increase in Africa. In the past week alone, there have been more than 4.8 million cumulative cases of COVID-19 reported. comprising 2.9% of global cases. This is an increase of 7% over the past week. Last week, Africa reported more than 131,000 deaths due to COVID-19, accounting for 3.7% of deaths globally. The SARS-CoV-2 strain continues to spread and mutate into different variants. 53% of the African states have the variant initially reported in the UK, 47% of the variant initially reported in South Africa, and 22% of the variants that originated in India. This demonstrates that in a global world, no country is fully insulated against the variant, and that until we are all safe, none of us are safe. Speeding up vaccination is key, and this remains a great challenge for our continent. To date, close to 54 million doses have been supplied, and of these, close to 60% have been administered. But we remain a long way off. Less than 0.54% of Africa's population has been fully vaccinated against COVID-19. By contrast, more than 75% of the population in Europe and North America have been vaccinated. This is an unsustainable situation, despite the fact that a number of clinical trials into COVID-19 vaccines were undertaken in Africa. Despite that, millions of vaccine vials are filled and finished in Africa. And despite the vaccine knowledge generation and production from Africa, we are seemingly last in the queue. This is unjust and runs contrary to human rights. A number of proposals have been put forward to resolve this problem, including vaccine sharing or donation. We do not have the luxury of time as we wait for developed countries to vaccinate their population first. Manufacturing our own vaccines is the best and fastest solution. At a number of sites on the continent, there are sterile manufacturing facilities, quality control laboratories, and cold chain packaging facilities in a number of countries on the continent. There are also product development laboratories with good manufacturing practice certificates. We do not lack the capacity to manufacture vaccines. What is lacking is intellectual property, active pharmaceutical ingredients, and financial resources to enable COVID-19 vaccine sites. The launch of Saving Lives and Saving Economies and Saving School partnership to vaccinate Africa funding could not have come at a better time. We have established 14-person commission on the African COVID-19 comprising experts across the 6 regions of the AU to support the implementation of the African COVID-19 strategy. The Commission's expertise includes virology, epidemiology, medical doctor, infectious diseases specialists, health economists, health systems and human rights and public health, molecular immunology, vaccine manufacturing, and gender-based violence and social science. The Commission will have to meet 4 objectives. Firstly, to implement the COVID-19 vaccine development and access strategy and its 3 objectives. These are clinical developments of the vaccine, access to a fair share of vaccines, manufacturing of vaccines, diagnostics, therapeutics, and removing barriers to delivery and vaccine uptake. Secondly, to develop a response strategies for the second and third wave of COVID-19 surge concerning monitoring the pandemic, preventing further spread, and better treating of COVID-19. Thirdly, working with experts to develop a strategy to align the health, social, and economic recovery of the African Union and benefit the regional economic communities and the member states. And finally, to support the AU Special Envoys in the COVID-19 in their effort to reduce economic harm caused by the pandemic. Supporting the 4 objectives are 3 cross-cutting themes such as gender and COVID-19 stigmatization and funding to finance work coming out of the 4 strategic objectives. To achieve our objectives, the Commission will work with Africa CDC, the AU envoys, and the African Vaccine Acquisition Task Team, AVAT. Will support member states with the financing and acquisition of enough vaccines to cover at least 60% of their population. The support includes close collaboration with the COVAX facility which will significantly contribute to the continental target of its participants and other key partners. The AU and Africa CDC have brought vaccine manufacturing to the forefront during the June 2020 continental consultation, which resulted in the vaccine strategy. Following this was a continental consultation in April 2021, dedicated to the African production of vaccines and chaired by His Excellency Musa Faki Mahamat of the African Union Commission. We have continued to work hard to remove barriers to the increased access of vaccines. We've established the African Vaccine Delivery Alliance, AVDA, comprising of key players from the private and public sector, international organizations, civil society, and academia. It is mandated to ensure that the rapid deployment of vaccines and associated supply equipment in the right condition, in the right quantities, at the right place. In addition, Alliance members support delivery readiness from a strategic, organizational, and logistics perspective, as well as on the critical area of communication and community engagement for COVID-19 vaccine uptake. Ladies and gentlemen, the task before us is a formidable one, but with the support of partners such as the Mastercard Foundation, we will reach our goals. This support will go a long way, and we will ensure that these resources are used for their intended purpose and that there is accountability and prudent management. May this partnership flourish and thrive, and may we continue to work together in support of our common future. I thank you. That ends the message from His Excellency President Cyril Ramaphosa. Thank you very much.
Thank you very, very much, Excellency Minister of Health for South Africa, Dr. Zweli Mkhize, who was speaking on behalf of the President of the Republic, President Cyril Ramaphosa, who is also the champion of the African Union for COVID-19. And the minister put a very strong case there for vaccination. He recounted that so far we are reaching, as a continent, reaching nearly 5 million infections. If you compare that with the fact that in February of last year, we only had 2 infections, that really shows the increase and the need for such programs as the Saving Lives, Saving Livelihoods that we are launching today. The minister spoke about the need for more vaccination. He spoke about the vaccine inequity that is blighting our progress, and he strongly emphasized that this cannot continue. He also spoke about the need for a gender-inclusive approach. So we thank you very, very much, Minister, speaking there on behalf of President Cyril Ramaphosa. So, Excellencies, ladies and gentlemen, we have heard from our key speakers for today, and they have all emphasized the importance of those 4 objectives that have been set out for this partnership between the African Union, the Africa CDC, and the Mastercard Foundation. They have all emphasized the need for more vaccination. So it is great and very timely that this intervention is coming at this point. So we thank you very much, just to emphasize that this is an unprecedented partnership that is aimed at saving lives and saving livelihoods. We want to continue repeating that, saving lives and saving livelihoods of African people, as well as hastening economic recovery on the continent. Let me take the opportunity to thank very sincerely the excellencies that have joined us today. And those are President Cyril Ramaphosa of South Africa, who was represented by his Health Minister, Dr. Zweli Mkhize. We also had President Paul Kagame of the Republic of Rwanda, who is the African Union's champion for domestic health financing. The Chairperson of the African Union Commission, His Excellency Musa Faki Mahamat, spoke earlier on. And then we also heard from Ms. Rita Roy, the CEO and Chairperson of the Mastercard Foundation. Dr. John Nkengasong, the Director of the Africa CDC, also gave us a rundown of exactly what is included in this partnership. So we thank you very much, Excellencies, for having joined us, as well as the special envoys and all those friends of this partnership who have been with us. We thank the the Mastercard Foundation and the CEO in particular. I beg your pardon?
When the President Tshisekedi just sent a message that he has been caught up in other commitments and really extends his sincere excuses to the other head of states on this platform. Just the message just came in now. Thank you.
Thank you very much. We've just been hearing there of the message coming from the chairperson of the African Union, President Tshisekedi of the DRC, who has been unavoidably caught up in other activities, but would really have liked to be joining us for this launch. So thank you very much, Excellencies. I was at the point of thanking the Mastercard Foundation and the CEO, Ms. Rita Roy, for the strong demonstration of confidence in the continent's leadership and in the future. We all hope that your work will inspire many other funders to take a similar approach in working with Africa. We also thank very much all of you who've been joining us from the African continent and from abroad. This initiative is really a beacon of hope and an outstanding example of the collaboration that is needed to really bring this pandemic to an end. As we have repeatedly heard, amid this pandemic, no one is safe until everyone everywhere is safe. And I think that this is a message that has been repeated many times. The minister there right at the end also talked about this when he said that we need a collective approach, and it is for all of us to work together to defeat this pandemic. And I think I speak for many in hoping that this initiative will inspire even more action across the bridge to bridge the gap and the divide in vaccine access for Africa. So that brings our launch of the program to an end, but I want also to advise the colleagues, communicators, and journalists who are online that immediately after this, we will go into a press briefing to allow Dr. John Nkengasong and Ms. Rita Roy to take questions from the media. For now, however, it is time for us to bring this special program on saving lives and saving livelihoods to an end. Thank you all, and congratulations once again to the African Union, the Africa CDC, and the Mastercard Foundation for this historic launch of great importance to our continent. Thank you, and bye-bye.